I'm very excited to talk today to talk about our vaccine distribution plan. I'm joined by Scott Bookman, the interim director of the Division of Disease Control and Public Health Response, who's going to walk us through how Colorado will successfully pull this off. We're also joined by Joni Reynolds of the Gunnison Public Health Department. She's the executive director there to talk about, from a county health perspective, their role in all of this, local public health agencies. We're also joined by Brigadier General Scott Sherman with the Colorado National Guard, who is our point person on many of the logistics involved. Now, Jill Ryan, our CDPHE director, isn't on this call because she's literally right now on with the federal government on Operation Warp Speed. So literally there's discussions in real time going on. Brief update on where we are with COVID-19. The numbers for today just came in 3,757 new cases. So we still are hopeful that this is a plateau. The hospital numbers have not gone up for a good week now. They've been stable, a little bit up, a little bit down, but we're very grateful for that we still have the capacity in Colorado to give life-saving care to people who need it, like my partner Marlon and any of those who need oxygen or intubation or whatever treatments are needed. Not everybody who contracts COVID will make it, but most will if they have access to the medical treatment that they need to get better. I want to thank everybody for their input into this vaccine phase distribution plan. Our main focus in creating the plan for Colorado is to ensure that we save the most lives and end the health crisis and the pandemic as soon as possible. That means, of course, prioritizing our most at risk, 65 and up, people with pre-existing conditions. For months, we've been carefully planning this process. We work closely with local public health agencies, providers, hospitals, many others. It's going to take everybody working together, local, state, private sector, federal, to make this happen and end the pandemic. Doesn't change. The minute you see that somebody else got a shot, doesn't change. We are grateful that our nurses and providers in COVID wards will hopefully be immune a month or two after they get that first dose. But it'll be here until there's widespread vaccination, meaning masks, social distancing, and washing your hands regularly. We did a dry run exercise yesterday with Vail Health to show when a vaccine is delivered to Colorado, how it gets to where it's going. In this case, Eagle County wasn't the real vaccine. It was a box with what we had all the conditions along the way administered to a patient. The vaccine lands, it's transported. We have the cold chain to manage, meaning the different the different temperatures that both vaccines need to be stored at, delivered to the provider, and then the provider puts it in the arm of the Coloradan. And we're ready. Last week, we got confirmation that Colorado's first allocation should be 46,800 doses of the Pfizer vaccine. Now, again, we've learned to sort of believe it when we see it, right? We've had different numbers of tests and masks, and sometimes the number delivered were a little different than the number we thought, but the initial order confirmed 46,800. And then we're also expecting within a week or two after that, when the Moderna vaccine is approved, 95,600 doses of that one. That's the maximum number of doses Colorado can get. That's our allocation. We obviously want more, and we expect more over time, but that will be the initial amount. And I want to thank everybody on the team. This year has been challenging for our team, but also challenging for the residents of our state. Many of us, ourselves included, haven't been able to see family or friends for months. I haven't seen my mom and dad for 9 months. Businesses are struggling. I want to thank the Republicans and Democrats in our state legislature for stepping up and doing what we can. We still need the federal government to act to help. And many Coloradans are facing financial hardship, reduced hours, lost work. And of course, most tragically, many Americans and Coloradans have lost a friend or loved one to this deadly virus. And our heart goes out to everybody who experienced loss, whatever form that loss takes. Now we're looking towards the next important, optimistic, hopeful, exciting phase, the triumph of modern science, and now the logistical process around administering the vaccine across our entire state. I'd like to turn it over to Scott Bookman to talk in more detail about how Colorado is going to successfully distribute our vaccine allocations to save lives and end the pandemic. Scott?
Thank you, Governor. And I just want to make sure that we have the slide deck up and ready to go. All right. Well, thank you all for joining us here this afternoon. And I'm excited to give everyone an overview on where we are headed in the next phase of our response to the pandemic, which is obviously allocating, distributing, and administering vaccine. So on the next slide, I will provide you just with kind of some level setting and an overview of how far we have come since March. We have taken bold and swift actions early in every area that we could to protect the health and safety of Coloradans. In the beginning, we were only able to do 160 tests per day and only at the state public. Today, we are capable of performing over 55,000 tests per day across the state. This is at the state lab, our hospitals. This is in partnership with private labs. We have come a long way in our testing capacity. We also know at the beginning, we had a lot of struggle with the supply chain, and PPE was one of the rate limiting factors in parts of our response. And so we at the state have done an enormous amount of work to ensure cache of swabs and PPE that will allow us to continue testing for the next calendar year. All Coloradans have pitched in to wear masks statewide, which has helped us to dramatically slow the spread of the virus. Though that, our North Star in this response is to ensure that our healthcare system capacity is breached and that we did not have to resort to crisis standards of care. Our healthcare partners have done an enormous amount of work for their own internal surge capacity. And at the state, we have built out 3 alternative care sites that, if necessary, could add up to 2,200 hospital beds across the state that would allow our hospitals to expand internal ICU capacity to serve those who needed it most. Next slide, please. So we are obviously moving into our new phase of the response, as I said, which is beginning to allocate and distribute and administer vaccine. So PFIZER submitted their EUA to the FDA on November 20th, and Moderna submitted theirs on November 30th. We were allowed to place our first order for the PFIZER vaccine of 46,800 doses on December 4th. And we will be placing our order of 95,600 Moderna vaccine either December 10th or 11th, which is tomorrow, or on Friday. Most important, we are expecting that the EUA for the PFIZER vaccine will be approved sometime between December 11th and December 14th, and then shipment will occur within 24 hours. We are told that concurrently, the Advisory Committee on Immunization Practices will be holding their emergency meetings on December 11th and 13th to provide the ultimate guidance on how these EUAs will be implemented. And then we expect to actually receive our first shipment of PFIZER somewhere between December 13th and 16th, and then Moderna will come approximately 1 week later. Again, this is all dependent on the supply chain and a steady supply of doses that is being given to us by the federal government. Next slide. Just as a reminder, the 2 vaccines that we are currently talking about are the PFIZER and the Moderna. The PFIZER vaccine is a 2-dose vaccine. The second dose is on day 21. Efficacy is at 95%, and that is the one that we anticipate receiving first, which will be in mid-December. Moderna is also a 2-dose vaccine. That one gets its second dose on day 28. It has a very similar efficacy profile as the PFIZER one. And as I mentioned on the last slide, we anticipate that it will begin arriving about 1 week after the PFIZER vaccine arrives. To be clear, these vaccines are more effective than the flu vaccine and have an efficacy that is comparable to the measles component of the MMR. Now, deploying this vaccine is the great newest challenge to public health in the response to this pandemic. And so to meet that challenge, in partnership between the state EOC, the Colorado National Guard, and our policy team, along with CDPHE, we have created a joint task force. And the goal of this joint task force is to ensure that we have all the tools that we need in place to implement our vaccine strategy. And that includes staffing, data and information management, and the complex logistics of dealing with the cold chain storage and the movement of all of this vaccine across our state. This will include working with our Joint Information Center, and then this vaccine task force will report up through the Vaccine Gold Group to the Unified Command, the policy group, and ultimately to the governor. Next slide. So we have a number of different roles and responsibilities in phase one. The role of the Colorado Vaccine Task Force is to plan and resource the execution of the vaccine plan that was created by our strategy team. They will monitor our progress and they will identify friction points. And then they will conduct dynamic planning to go resolve issues and be adaptable in changes as they need to be made. CDPHE will approve and enroll providers in the CDC COVID vaccine program and be our conduit to CDC. It is our responsibility at CDPHE to coordinate the allocation and distribution of vaccines to our pre-positioned hubs and directly to providers. We will also provide technical assistance and guidance to our local public health partners, and we'll track and report daily use of vaccines. Now, I'm going to turn it over to my partner, Joni Reynolds, to talk a little bit more about the role of our local public health authority.
Thank you, Incident Commander Bookman. I'm pleased to join you. I'm Joni Reynolds, and I'm the Director for Public Health for Gunnison County, Colorado. And I represent 53 of my colleagues around the state who lead our local public health agencies in all 64 counties. The local public health agencies are taking a lead role in the vaccine response at the local level in working in close partnership with their healthcare systems in their community, along with their healthcare providers and other key leadership in their community. We each have significant roles as healthcare systems and local public health agencies, along with the state health department and the task force and others that Incident Commander Bookman mentioned. So on the next slide, I'd like to just share with you some of the work that's happening at the local community level with local public health agencies. In addition to the work that they're doing in the COVID response for testing and follow-up on cases and investigations, contact tracing and providing support and technical assistance within their community, they are standing up collaborative efforts along with community leadership from public health, local incident command, healthcare systems, emergency responders, law enforcement, medical community, elected leaders, and other leader and community members to provide information updates in their community, to support providing education for both providers as well as the general community, question and answer sessions, and really have identified local leadership to lead local COVID vaccine teams. Those local COVID vaccine teams are starting their steps to identify priorities and the implementation so that we're ready when the vaccine arrives in local communities this week and the following week in those first 2 weeks of distribution. I'll turn it back to Incident Commander Bookman. Thank you.
Thank you, Joni. Now, we know that in the early weeks and months of vaccine distribution, that supplies will be limited. This has been a historic effort to create this vaccine in a record period of time. And while we're going to get there, it is going to take us many months to get this out to the general public. And so we were required to create a vaccine prioritization to ensure that we take these precious few doses and give them to those who need it the most. And so our prioritization philosophy was based on how can we save the most lives and how can we end this crisis as quickly as possible. And on the next slide, I will talk you through our phase-based approach. So we're really talking about this happening between now and next summer. And phase one will begin as early as we receive that first allocation of vaccine on the ground in Colorado. Phase 1A will be focused on our highest risk healthcare workers and individuals. So those are people who are providing direct contact with COVID-19 patients for 15 minutes or more over a 24-hour period. So think about ER staff and ICU staff and respiratory therapists and those who are working in COVID-specific units in hospitals. Also, we know that the staff and residents at long-term care facilities, such as nursing homes, have been disproportionately impacted with hospitalizations and deaths from COVID. So they too will be included in phase 1A. Phase 1B We'll look at moderate risk healthcare workers and other responders. So these are people who are working in the inpatient setting in a hospital, but they may have less direct contact with COVID-19 patients. Workers who are in home health, hospice, and certain dental settings. Also, EMS, firefighters, police, corrections workers, dispatchers, other first responders, and those who are doing COVID-19 response, such as laboratory technicians. We anticipate that that will carry us through the winter. Again, all of these timelines are subject to change based on the supply chain from the federal government. As we move into phase 2, we put our focus on higher risk individuals and essential workers. So these are people who are over the age of 65, people with any chronic medical conditions that make them more susceptible to bad outcomes with COVID. So these may be people with chronic lung disease, significant heart disease, and those who are immunocompromised. When we start thinking about our essential workers, these are people who interact directly with the public while they're at work, such as grocery store workers and school staff, those who work in high density settings like meatpacking plants and farms, and then other healthcare workers who were not covered in phase 1. And then finally in phase 2, any adults who were involved in the COVID vaccine clinical trials who received a placebo during those trials. We anticipate that phase 2 will take us through the spring, and then in the summer, we will begin distribution and allocation and administration of vaccine to the general public. All of this prioritization is subject to change based on updated recommendations from the federal government, from our partners at the CDC and the FDA, and from the scientific literature. We're going to need to be flexible as we learn more about this vaccine and as we find the best way to allocate it across our state. Next slide. So here's a map of our distribution centers and providers for the PFIZER vaccine in phase 1. As you've heard many times before, the PFIZER vaccine is extremely complex because of the ultra cold chain storage that is required. And so our distribution centers were strategically located across the state. And these are places where they have the freezer capacity to handle a large volume of this ultra cold chain storage. From there, doses will be broken down into smaller components and moved to the blue dots, which are the providers across the state who will also have the ability to administer this vaccine to those who need it. Next slide. Now, these locations were identified because of their ability to handle this ultra cold chain storage and their willingness to work with us to redistribute the COVID-19 vaccine to other phase 1 providers in their region. We also looked at an equitable distribution across the state and took into consideration the transportation logistics of moving vaccine across our state during the expected winter conditions that we'll see in the next few months during phase 1. Next slide. So we know that early doses are going to be very limited, but over time they will expand. All doses will be free, and every county will have access to this vaccine. In the initial portion of phase 1, vaccines will be administered at local public health agencies, hospitals and healthcare systems, some of our federally qualified health centers, and a small number of pharmacies. In the longer term, as more vaccine becomes available, you will see these administration sites expand into our rural health centers, safety net clinics, doctors' offices, and then other locations that we need to stand up to ensure that all have access to getting this vaccine. But here's a little bit more granularity on the PFIZER vaccine that we anticipate getting in week 1. And so again, we expect this somewhere around the week of December 14th, and we will receive 46,800 doses. And this map shows where the initial distribution will go, and then where it will be redistributed to those providers in blue. Now, we know that the Moderna vaccine, at almost double that allocation, will be coming in the second week, and we will make sure that we are level loading our allocation of vaccine to ensure that we are providing the best allocation of vaccine across our state. Next slide. After we receive that Moderna vaccine the week of December 21st, we anticipate receiving shipments every week after that. However, that all depends on the supply chain and the availability of this vaccine to the federal government, who is coordinating the actual distribution of the vaccine to the states. Next slide. So, in phase 1, the majority of the early recipients will get it through their employer or their local public health agency if you are a healthcare provider. The residents and staff of our long-term care facilities will receive vaccine through the federal pharmacy partnership that will most likely be including Walgreens and CVS as the partner who will actually be administering the vaccine to those who live and work in those settings. As we learn more about what phase 2 and what phase 3 looks like, we will provide more information about the providers who will be eligible to give that vaccine and the settings in which they will do it. So there's more info to come. We know that there are going to be a lot of questions from the public. We know there are going to be a lot of questions from those who believe that they are in phase 1. And so we have set up a hotline at CoHelp. The phone number there is 1-877-462-2911. Also, can visit our new website, covid19colorado.gov/vaccine, to get all of this information. Next slide. So we want to ensure that not one dose of this vaccine gets wasted. To ensure that, we are going to require that all phase 1 providers report within 72 hours whether they have given a dose of the vaccine. The vaccine has a stable shelf life of about 5 days. We want to know at day 3 if it has not been administered, so we can work with that provider to ensure that we come up with a plan for them to utilize it, or we can move it to another location to ensure that we do not waste any doses. Every Coloradan's immunization records are confidential, personal, private information that will not be shared publicly, and the state of Colorado will not be sharing personal information with the federal government. Governor, I turn it back over to you.
Okay, just starting my video. Thank you so much, Scott, for your work. And look, while this is hopefully giving us all something positive to think about, just a reminder, it's a long road ahead. With all the first Coloradans will be vaccinated very shortly. This timeline is also dependent on the federal government sending us the weekly shipments of the vaccine. We want, 5.7 million vaccines for every Coloradan. The sooner they send them to us, the sooner we'll be able to administer them. And this is exciting. We need to really be careful in these next few weeks here so we can bridge the time till the vaccine is distributed. We're about 1.69% of the U.S. population, and we're getting 1.69% of the available vaccines. It's being done very fairly, is what we're being told, and we and others will hold them accountable for that. This vaccine is really the gateway to the end of the pandemic, to return to normalcy. So let's double down in the next few weeks and months. Wear a mask around others. It's like a 50% effective vaccine that we have today. Reduces your chances in half of getting the virus. Staying 6 feet from others. Don't have social gatherings outside your household. Remember, this is a marathon. We're getting there. We can see the end in sight. We're in this together, Colorado, from the very beginning. We're excited to be fully transparent about our plans in Colorado to lead the nation for vaccine distribution. With that, we'll be happy to take some questions.
Hello, Governor Polis. This is Vinny Del Giudice of Bloomberg News in Denver. It's good to hear you and your family are doing better. How will Colorado secure these valuable vaccine supplies? Thank you very much, sir.
Let me go to Scott and General Sherman for that. Could you elaborate what you mean? How will we secure them? Do you mean how will we keep them safe? Is that what you mean, or what?
Yeah. How
mean?
will you keep them safe? Will it be in secure facilities, military facilities,
Good.
civilian?
Yeah, we'll go to General Sherman and on that. General.
Yes, sir. There are actually 8 facilities, 8 hubs around the state that these vaccines will be stored in ultra cold temperature or in freezers. We're not going to release exactly where those locations are, but local law enforcement will know where they are and will also help with security on that. And then we will use a combination of National Guard personnel and medical couriers to actually distribute them down to the local level.
Governor Steve Steger from 9 News. I know there was some confusion.
Could you speak a little louder, please?
Oh, I apologize. Steve Steger from 9 News. Can you hear me?
Yes, go ahead.
Okay. Governor, I know there was some confusion last week about where prisoners and folks who are incarcerated in Colorado's prisons and jails fall on this distribution list. What was the conversation that happened about this, and kind of clarify that for the public?
Yeah, every Coloradan is treated fairly under this. Whether you're in prison or not, if you're 67 years old or at risk, wherever you are, you'll have access to the vaccine when 67-year-olds have access to the vaccine. So nobody is penalized because they're incarcerated, and of course, nobody is given any advantage because they're incarcerated.
Hi, Governor. It's Rick Sellinger from Channel 4. I'd like to follow up on Steve's question, first of all. And is that a change from what you said the other day, that those who are incarcerated will not get it before those who are free?
No, that's the same. Everybody will be treated the same. And so if you're at risk, regardless of where you live, you get that when your turn is up. I think there had been some speculation that based on other iterations of the plan, somehow people would get it first in prison. That was never what we planned to do. It's not what this plan is. People who are at risk, our goal is save lives and the pandemic. There is also in the first responders, correctional workers, others. So the people that are correctional workers are considered first responders as well and prioritized.
Hi, this is Erin Prater with the Gazette in Colorado Springs and in Denver. My first question is, what percentage of the population here in Colorado would need to be vaccinated in order for us to reach herd immunity, if that's possible, or what is ideal, what is expected? If you can kind of walk me through that, because I know there'll be plenty of people who won't want to get the vaccine. Also, what is the plan to vaccinate children? From what I understand, the vaccine is not currently approved for children, but there are children who have comorbidities as well. Thank you.
I'll answer the second one. It is for 18 and up at this point. There are active tests, my understanding, 12 and up tests that we would have results on at some point. If it's available for 12 and up, the plan would be amended for 12 to 64, not just the 18 to 64. We will connect you with one of our medical representatives, Dr. Franz or Dr. Hurley, for the medical question that you asked, and we'll do that after this press conference.
Thank you, Governor. This is Michael Booth from the Colorado Sun. Two questions, one for you, one for Shelby. One, will you consider tighter restrictions on students going to school, receiving the COVID vaccination before they're allowed in school? And Shelby, if you could talk about how you will get vaccine acceptance in your part of Colorado and how other rural Colorado counties are talking about making sure that there is public acceptance of the vaccine and public take-up at levels that will give everybody protection.
We've learned from the early days of this pandemic that schools are a very safe place to be. In fact, we think it's generally the safest place to be for students and teachers. They follow protocols well. We've had a very low incidence in our schools. I started a back to school task force involving teachers and school board members and parents. We're hopeful that nearly all Colorado kids will be able to return to school in January. Again, there's an asterisk that if your kid's class has somebody who comes down with it, that class might go online if there's an outbreak for 2 weeks before they return to in-person education. But with masks and with cohorting, schools are one of the safest places that kids and teachers can be. Second,
Shelby, did you want to go to Shelby for the other question?
yes.
Hi, it's Joni Reynolds, and I'm sorry, could you repeat the question?
I think you meant Joni, by the way.
I'm sorry, Joni. Yes.
Confused. Yeah, go ahead.
Could you repeat your question?
Yeah, Joni, just asking about your part of Colorado and also the people you represent in other counties in Colorado, how you will get vaccine acceptance and how you will market it to your people so that there's enough acceptance at high enough rates that you get herd immunity and get the effective block of the virus that everybody's looking for.
Yeah, absolutely. We're all looking to have that protection throughout our community to really move to a different world when it comes to COVID and how it's impacting our community. And so we're doing that directly and talking with our healthcare providers who are trusted in our community to talk with their individual patients. But we're also doing community forums and providing responses to questions through a question and answer forum. We're also providing information through social media and through other sources throughout the state. Many local public health agencies are reaching out directly to community members to provide that information.
Thank you.
Hola, buenas tardes, gobernador. Jackie López con Telemundo. Me gustaría que explicara en español el plan de distribución una vez que llegue la vacuna y qué agencias están involucradas para asegurar que llegue a su destino.
Sí, gracias por su pregunta. Ahora presentamos los planes del vacuano y vamos a darlo a la gente de Colorado muy pronto. Es importante darlo a personas quienes están trabajando en un hospital antes porque ellos están muy cerca de personas con COVID-19. Esta es la empieza de la termina de la pandemia, pero todavía por los próximos semanas y meses necesitamos usar tapabocas y tener distancia entre nuestros propia y otras personas.
Hi, this is Alex Burness with the Denver Post. Two quick things. First, for Mr. Bookman, what's the latest expectation for how long that third phase will last? You've said it'll start in the summer, but how long might it extend? And then secondly, the new guidelines don't mention congregate living centers such as prisons or homeless shelters. So to be clear, is it the case that people in those settings who do not have a high risk condition associated with the first two phases, such as being over 65, will simply be lumped in with the general public in phase 3?
So the first question is really dependent at this point on the supply available by the federal government. We're saying summer, and that is all predicated on having enough vaccine to provide to all Coloradans who want it. Obviously, there are many million people who live in our state. We anticipate that at some point this will be approved for some subset of our children, which will increase the amount of doses that we'll need. So it's hard to give an ETA on it at this point. In regards to where those living in congregate settings will be, as the governor indicated, it does not matter where you live. It matters what your susceptibility to this illness is, and you'll be vaccinated in that phasing.
Hi, Governor. Faith Miller with Colorado Newsline. Will the inpatient healthcare workers who are in the first phase be required to get the vaccine? And also, could you provide some more detail on which inpatient healthcare workers will be the first to get it? Thanks.
So many hospitals and healthcare providers have their own rules and employment policies that dictate who needs to be vaccinated for what. And of course, many of them would be in updating those. So you're certainly welcome to inquire what they do or don't require of their workers. The priorities for people on the COVID wards. So it's first the nurses, the doctors on the COVID wards, and then it's the general personnel in and around the COVID wards that might not be with the patients. People who clean the COVID wards on maintenance, the people who check in patients would be the next group.
Hi, this is Erica Meltzer from Chalkbeat. There's two related questions here. In that phase 2, we see educators and childcare providers along with a large number of other people. Do you know roughly how many people are in phase 2? Will there be any prioritization of groups inside phase 2? And will this vaccine be available to those people in a way that would influence school reopening this school year, or is that not really in the works?
Well, all the plans around schools that have been open have been pre-vaccine. Many schools have been open throughout this year, and our goal is for every school to be open, or hopefully as many as possible in January. It's the safest place, and the data shows that for both teachers and students. So that's all. All that planning is, of course. There will be some teachers in the over 65. Range. They've been prioritized for at-home work, but they would receive a similar priority as people over 65. They'd meet two of those criteria. They'd be in the group of essential workers, and they'd be over 65. So, again, it's also important to remember that immunity doesn't start when the day you get the shot. The first shot might, in fact, confer some immunity a week or two after, but the tested efficacy numbers are after the second administration. And so you get the shot, 25 days later, the second, 2 weeks after that, you're immune. So if you get your first dose in May, you are likely to be immune at the high levels by early July.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado en español. Gobernador, ahora que ya está confirmada la entrega de las vacunas y su distribución aquí en el estado, ¿cree usted que al estar disponible para todos es posible que las empresas exijan a sus empleados la vacuna contra el COVID?
¿Los empleados de qué negocio?
En general, los trabajadores de las empresas.
Y la pregunta es ¿qué? ¿Cuándo van a recibirlo o qué?
La pregunta sería si las empresas obligarían a sus trabajadores a
Sí.
recibir la vacuna.
Sí, depende de la empresa. Algunas empresas como hospitales tienen un requerimiento que ellos ya necesitan tener vacuna contra measles, mumps, otras condiciones. Pienso que especialmente los negocios en el espacio de salud van a tener necesidades similares sobre eso.
Hi, it's Jessica with the Denver Post. Going back to the congregate settings, we know that these areas have had outbreaks and that these outbreaks can sometimes transmit the virus into the community as well from people moving in and out. Can you tell me a little bit about this decision to focus more on who people are and less where you're living?
Well, the virus affects people of different ages extremely differently. So the death rate, if you're over age 65, over 70, significantly higher than if you're under that number. I'll give you some of the numbers here. Let me see. Let me find this. Just give me a moment, see if we can share it. But that's really the stark reality. If that we want to save lives, we need to prioritize based on who is the most vulnerable from this virus. And so that's really the most important thing. And age itself is a powerful and highly relevant proxy for who is most at risk, which is why it's very important that those who are over 65 in general be able to receive it safely before those that are under 65. We have here it is. So the fatality rate, if you're 20 to 24, 0.06, 30, 0.02. If you're 70 to 74, 1.67, 75 to 79, 3.2, over 80, 8.3% fatality rate. So 1 in 12, perfectly healthy 81, 82-year-olds will be killed by this virus who contract it. So just, you see a difference of 100 times in the fatality rate between different people of ages. And so the moral path for society to take is to protect those who are far and away more likely to lose their lives to the virus.
Hi, Governor. This is Anusha with 9 News. Wanted to see if you could address the specific components of the distribution plan and how the state is going to be making sure that this is a fair and equitable process, in particular for our minority communities that have disproportionately been impacted by this virus.
Yeah, we are really engaging the broader communities of color and faith leaders in a conversation around vaccine confidence, making sure that communities understand the science and data and the fact that these vaccines have already been tested in many different subgroups, people of different ages, different races. All of those different folks have been part of the testing, which shows a highly effective vaccine. So it's a matter of winning over the confidence. And we totally understand that it's not necessarily the governor that can do that. It is faith leaders and community leaders. And so we're engaging them in a meaningful, science-driven discussion so they can in turn be the ambassadors in their communities.
Hi, Governor. Andy Kenny at Colorado Public Radio. Glad to hear that Marlon is home and doing better. Wanted to ask you, you've been publicly contemplating this expansion of Mesa County's 5-star designation for restaurants if they meet certain minimum criteria for indoor dining. We've heard from some experts at Harvard and in local public health who question whether it is a good idea to encourage that indoor dining as we run into potentially the peak of the pandemic. Is that still under consideration? And if so, how would the statewide restrictions and enforcement compare to Mesa counties?
So there is a draft of the potential statewide guidance that was available last week. We've got hundreds of comments by Friday. We're now pouring through those comments. Really, we put a health lens on this. Is it possible for a restaurant to be able to serve people indoor in a reasonably safe way? It is. It's not the same way they served people a year ago or 6 months ago. But there are absolutely ways to do that. We're excited to figure it out. We know that, of course, restaurants and bars are one of the big sources of the spread of the virus, but it's a question of what you do and how they do it in those restaurants. And so we are working with counties that want to find a way to have some indoor dining over the next few weeks to have a state framework to do that in a reasonably safe way.